everyone. Come to an end of a fantastic 3 days. Can't thank the speakers enough and the audience for being such great participants. And I know I speak for everyone that I think this has been a great boot camp. Can't wait for next year. Just a few housekeeping announcements. We have just distributed the evaluation form. Could you please fill that out before you leave? This is important to us. Your feedback is important for us to work through improving the program for next year. So, very quick to wrap up of what we learned today. So we started with a presentation by Prof, who took us through, the intersections of human rights, ethics, and implementation research. She talked about the principles of human rights and how the provision of health is basic human right and perhaps one of the most important social goals that to acquire or to realize this, it's not just a social health aspect, but we also need to focus on social and economic factors. HIV/AIDS is a social disease, and if we really are hoping to make any progress in controlling this epidemic, we really have to start thinking about human dignity and social justice, and this needs to be a fundamental aspect of our global preparedness plans. She took us through basic principles of research ethics, and she gave us an overview of participatory human rights-based research methodologies, which can be used as a tool for social change by including members of the community, either as research team members or members of the advisory board. And this methodology can be used to identify human rights violations and to provide solutions and recommendations to address these issues. Prof also gave us some examples of the specific HIV implementation research that she ran in prison and needle exchange, and what she learned from those and how these projects were used to improve stakeholder engagement in the context of human rights and ethics. We went on then to a fantastic discussion with various experts who work with different key stakeholders. We heard their experience of engaging with key populations and the challenges of working with them, and what perhaps for those of us who might be considering working with key populations, what we need to do. And I think the common thread in the discussion was that we need to be inclusive from the point of our study planning and conceptualizing our research questions. We need to engage the populations early. We need to be accountable for what we do in terms of our research activities. And we need to understand the context of research at the point where we approach them. Right from research design to study dissemination and publication. Sorry, I've got too many notes and I can't read my writing. We then had a session on disruptions of implementation research during COVID-19, and we had a live stream video from who covered unethical issues to consider when we are working or doing research in the context of COVID-19, as well as humanitarian crisis. We need to think about things like risk mitigation, behavior change, compounding vulnerability and engagement. How do we reopen the trial, and things to consider in these aspects, and shifting research priorities in this particular context. He also cited some ethical considerations from various publications conducted on HIV cure, specifically involving analytical treatment interruptions and how we would commence these trials in the context of COVID-19. Sheila then shared with us some of the challenges that she faced even well before COVID in terms of conducting research in the prison setting and how things, how the challenges got more complex during the period of COVID. There were some plus points in terms of how the team had to adapt to working in this setting. They also developed new collaborations and had to think out of the box of doing certain processes that were taken for granted, for example, taking informed consent. Liu shared with us his experience of applying implementation science in conducting contact tracing in COVID-19 in New Haven. He talks about how contact tracing was actually a complex intervention and how this was applied in an emergency situation, trying to achieve multiple objectives. He shared with us how he used multiple methodologies to triangulate findings, assess the impact of at multiple levels, and provide solutions to the health department to improve the system. So I think it was a nice real situation and application of what we've learned in the last 3 days. We had a discussion session then on breaking silos and how we can bridge the gap of working with the community. There were many aspects which were discussed. Key points being that stakeholders are each probably central to the work that we do, and they are the experts, and so most of our problems are multi-sectoral, and so we need to hear their views in order to build solutions that are effective and that can work. And this can be done through working with community advisory boards, or even hiring members of the community as part of our research team. Apart from hearing the views, it's also important to include them in the way we disseminate our research findings to make the greatest impact. Community-based organizations should perhaps be tapped more in terms of working with them to conduct research, and this might be something that we need to think about in a Malaysian setting with regards to perhaps building capacity with them, providing more training and getting them more involved in some of the research that we do. Prof also talked about how CBOs should really be part of the formal healthcare system. They really have their fingers on the pulse of the ground and really can be tapped to get mobilized quickly in situations of emergency, and also tell us what the key problems are within society. We then had a breakout session, and there were reports on research in progress in Group A, and Track B was on M-Health strategies on implementation science. And then we had the final lecture by Mona in terms of economic evaluation and implementation research. It took us through the importance of doing economic evaluations, the definitions of cost effectiveness, cost utilization, and budget impact analysis, and took us through some of the key features, pros and cons of using each, and how to report some of these studies in the literature. So we've reached an end, and I'd like to invite Prof. Eva and Rick to say a few words before we end.